Hi, I'm Professor Dickinson. I'm working in the lab. I'm going to go over the procedure for your IV push module. So first of all, you need to log into Canvas under your lab class. So it'll be 201L, and you'll find all the information listed under that. If you're in fourth semester, it'll be 202L. So first of all, you want to read all the information that is listed there. You'll also get PowerPoints in class, and you'll have a lecture for the first, before you come in to practice. So you'll be getting the information that will list 6 different scenarios, and they're going to be all IV push. So you need to look at the different medications that are listed. You could be tested on any of them. So one of them is going to be through the saline lock directly, and the other one will be through the tubing. And I'll demonstrate both of those. But first of all, you need to look at all of the different medications and make up medicine cards. So we want you to use your Davis drug guide, and what you'll be looking up is IV push, which also is listed in the book as direct IV or intravenous push medication. So in the book, you want to find the drug first. Each drug is listed, and then you'll go under implementation, IV administration, IV push. It'll tell you there whether it needs to be diluted, if it's concentrated, and then it'll also tell you how fast to administer it. So some will tell you over 2 minutes. Some of them will say how many milligrams per minute to push it. So it'll be different with each drug. So you'll need to look at that. The other things you need to look at is the routine things listed under the medications. So we only care about anything that is direct IV. So the side effects are going to be all the common ones, which are the underlined ones, so that would be for all of that for that drug. But also pay attention if it says anything specific to direct IV or IV push, because sometimes if you push it too fast, some drugs will cause things like hypotension or dizziness or something like that. So you want to identify those. Also, when you're looking in through the implementation, you also want to look at the very specific for each drug, and then also for the nursing considerations, if it's IV. So all of that can be found in your Davis drug book, and you want to put it onto, this is one of the forms that we use. So you fill that out ahead of time and bring it into the lab and we'll check it. Now we also have to do the math. So you're going to find that information in the drug book as well. So the one that I'm using as an example is furosemide. So we have the form that you need to complete, but I'm going to go over it specific here on the board. So our scenario will tell you what it's supplied, 40 milligrams per milliliter, and then it'll also give you, the scenario will give you the dose. So in this case, the dose that we're going to be giving is 20 milligrams. So we need to get the supplied amount, the 1 per 40, 20 milligrams per dose, and it comes out to 2 milliliters per dose. So the other thing you want to consider is how much time it needs to be given over. In this case, for furosemide, it says that it needs to be given specifically IV push over 20 milligrams per minute. So this is an easier one because we take the 1 milliliter per 20. Our dose is only 20, so it comes out that we need to give this drug over 1 minute. If it was 40 milligrams or a higher dose, then we would just change this number to come out how many minutes we need to give it. Typically in the ICU, we might give 100 milligrams. So if we were giving this medication, it would be over 5 minutes. So this one's very specific to the drug dose that we're giving. So now we know that we are drawing up 2 milliliters. We're going to give it over 1 minute. So we have 2 milliliters over 1 minute. So we need to calculate how much we're going to give over the whole time. So 1 minute is 60 seconds. So we're going to be calculating our dose every 15 seconds to keep it on an even time frame. So we have 15 seconds per dose. And when you divide that out for our whole 2 milliliters, if we give 0.5 milliliters every 15 seconds, we'll evenly give our 2 milliliters over the whole minute. Okay, so that's how you calculate it. So each drug will be different based on how much you're drawing up, if it has specific recommendations for time, and we'll spread it over the whole time evenly. So I'm going to demonstrate that in the rest of the demonstration with the hands-on on how to do that evenly looking at the medication. So the other thing that you need to do is get the calculations, do your card or the sheet on the information. You're going to be memorizing both of those. I need to check them off for somebody in the lab, so you bring them to us, we'll check it off to make sure all the information is correct. And then you would come to the lab to practice, and we'll give you a packet of all the supplies, and then you'll go out to the lab and practice. So we'll have each of the medications that you're going to be checked off on, and syringes and all the supplies. You need to practice a minimum of 1 hour before you can sign up to be checked off. And then once you sign up, it's just like any other checkoff. We'll give you a date and a time. You need to come in your full uniform and bring your checkoff sheet, which will be this. And also before you come in for this checkoff, you're going to be having an initial that you actually practice. So these are the steps. Along here I'll be demonstrating. So when you get checked off, you're going to be doing 1 through the saline lock, the second drug through the tubing. So if you look at the list of medications, there's 6 medicines, and each of them are designated whether they're through the saline lock or through the tubing. So you'll be randomly given 2 of the drugs. You'll also be checking off on cefotriaxone, which is an IV antibiotic, and every student will be checking off on that. So that one also will be listed. So you need to practice all of those, and then you'll be randomly given one of those for the checkoffs. So you'll be allowed at least an hour to do the checkoff on the checkoff day. You need to memorize the chief information of the drug and be able to give it for each of them to the teacher that is watching. And then you need to prepare the drug and dilute it if it needs to be diluted. And you need to know if that happens, and it'll be telling you that in the information. So some of the drugs will be coming in powder form. Some of them will be liquid, but you'll also be diluting it with saline. So each of them have different considerations that you'll be doing and then be giving over the allowed time. The other thing that we're looking at on the checkoff is that you follow appropriate protocol, which is aseptic technique in administration and using the 6 rights when you're giving the medicine. So I'll be demonstrating exactly the technique with the furosemide, and the actual technique of giving it through the saline lock or giving it through the tubing will be the same technique for each drug, but the amount that you're giving and the calculation for the math will be different for each drug. Okay, so I'm going to demonstrate giving the furosemide through a saline lock. So I have my checkoff sheet here. It gives me the steps on doing it. So first of all, I'm going to verify my patient. So hi, Mr. Smith. I'm going to be giving you your furosemide. So I want you to identify your name and date of birth for me. And I'll check that against my order. And then I'm going to be giving you your furosemide today. So the other thing I want to check is make sure his saline lock is patent. Want to swipe in and out with my hands and put on gloves. And it looks good to me so far, so I think I'm going to go ahead and prepare my medication. So I've already scanned it. I have my furosemide. This one happens to be 20 milligrams per milliliter, so I'm going to drop 1. So I got the appropriate size needle. It's 3 milliliters. And then this is a twin pack. So with these syringe, you use the red side to drop out of the vial. So you need to put this on, pull this out. So even though this is brand new, I still need to look at it again, take it off, and I need to swab it for 15 seconds. So since this is a vial, I'm going to be drawing up 2 milliliters. Air to air, and then flip it up and draw the solution. You always want to scoop and not recap. So when we get the medication out of the Pyxis, we usually will have a label. If we don't have a label, then we need to label it with the patient's name, the dose, and the drug. So it's furosemide 20 milligrams that I would label this with. So I'm going to be going to the patient room and going to be checking this. So Mr. Smith, I'm going to be giving you your medication now. Put you up so you don't have to bend over. So even though this has an orange cap on it, I still need to clean it off. And I'm going to check it with the saline, first of all. So I'm just going to push a small amount in to make sure that it's patent. Unclamp it. Mr. Smith, does it hurt when I push? I'm also checking to make sure it's not red, that it's not leaking, and that it flows evenly, easy, and no pain. So every time you connect, you need to clean again, even if you just took the other one off. We're trying to decrease sepsis. Okay, so my syringe, we already calculated that each 15 seconds I'm going to be pushing down to the half, here, here, and here for the whole minute. So I can turn my watch around so I can watch it as I'm pushing, or you can count out loud, which some students will do. So I'm usually going to start right on an even number. So I'm going to start on the 6 for my watch, and then you'll see it as I push it. So I'm going to go to the 5. So starting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So I almost got it exactly. So I'm going to take this off. So it still has a little bit of medication in the line. So I need to take this syringe off, put my new one on. So I'm going to clean it again in between. And this will be saline to flush it. So the first milliliter, I'm going to do it slow again, just to make sure. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So that was about 1 milliliter over that time. So it just goes a little bit slower, and then I can evenly flush the next 2 milliliters slowly, just to make sure that all the medicine goes in. And then this will be patent for the next time. Okay. So then I'm going to go ahead and cap this with the orange cap. And we're all done. Okay, Mr. Smith, I'm all finished with your medicine. So let me know if you have any problems like dizziness or anything like that. You've gotten it before, so I think you'll be okay, but anything that's different, let me know. Okay, and that's it. Now I just need to clean up all of my supplies. Okay, now I'm going to demonstrate giving famotidine through the IV tubing. So I've already calculated out my medication, looked up my medicine, determined how long it needs to be given. It needs to be given over 2 minutes, and I have a total of 8 milliliters. So it turns out that I will be giving 1 milliliter per every 15 seconds. So with the tubing, though he already has IV fluids running, so this case it's normal saline. So with whatever medicine you're going to be giving, you need to check in Micromedics and check for compatibility between the solution that's hanging and the medication you're going to be giving, because then you want to make sure that you can give it through the tubing. If it's incompatible, then you should use another line, or you need to flush it and you maybe use the Y-site. The other thing that we want to look at is what rate that it's running at. This one is running at 100. So when we're pushing, we're going to be clamping the tubing in between. So if it's running at 100 and we clamp it for 15 or 10 seconds, it's going to beep because it's going to be running too fast. If it's running too slow, it's not going to flush in between. So usually we want to put it on 75 milliliters per hour, whether it's running too fast or too slow. So in this case, we're going to change it to 75. And then restart it. And then I'll change my gloves. I have my medication. I've already scanned it. I check the IV site to make sure it's patent. And then I need to find the lowest port. Did I hit restart?
Start. Right there. Start.
Start here. Okay. So I'm going to find the lowest port from the patient, and it's this one. I need to clean it. I'm going to connect my medication. It should be labeled, either pre-printed or I would label it when I drew it up. So what I'm going to be doing is giving 1 milliliter every 15 seconds. So in this case, I'm going to be clamping it for 10 seconds and then unclamping it for 5. So I'm going to repeat that. So during that 10 seconds, I'm going to give the 1 milliliter. when I unclamp it, then it's going to continue to push the medicine in. So I'm going to start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Unclamp it. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. A little behind. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. A little bit slow. 1, 2, 3, 4, 5. Clamp again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now open it up, and since it beeped, I want to restart it. 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then 1, 2, 3, 4, 5. So I'm going to just take this off. Then I can clean it again and put the orange cap on it. And then let it continue to run at this rate so that it goes in. I can let it run for a minute or so. Now I could also flush this with saline if I thought there was a little bit residual in this, but these are pretty flush to the tubing, so it should have gone in. So I'll clean up all of my supplies, and then I need to come back and change this back. So it was running at 100, so I need to change it back to 100 and then start. Then I'll let Mr. Smith know that I'm finished giving your medication, so let me know if you have any problems or if you have any questions about it, and I'll try to see if I can answer them for you. Otherwise, I'll be seeing you later. Okay, thank you.